Make a health policy giving priority to the elderly population. 11th January 2022. For any country, if the youth should be seen as a dividend, then the old population should also be treated as a huge resource of experienced and knowledgeable people. Maintaining health and their capabilities to convert them into productive members of society instead of dependents depends on two primary factors. Some facts to keep in mind related to the elderly population of India. Life expectancy has increased from 50 years to 70 years in 2014 to 18 as compared to 1970 to 75. The number of elderly people in the country is 13.7 crore, which is estimated to be 19.5 crore by 2013. According to India's first long-term aging study, 11% of the country's elderly suffer from at least one of walking, visual, and audible or mental disorders. Our elderly need the best of access to health care. There should be a health system that is affordable and also linked to care. According to the 2016 Healthcare Access and Quality Index or HAQ, we have raised it to 41.2 in 2016, but we are far behind the global average. What are the reasons? Basic quality health services in small towns and rural areas are inadequate. Family neglect, low education levels, socio-cultural trust and low trust in institutional health care services and lack of affordability to spend worsen the situation. Health expenses for the physical challenged elderly is a big problem. Neglected life surrounds them with mental and emotional problems. About 40 crore people in the country do not have the capacity to bear the expenses on health. The solution: Ayushman Bharat and health insurance scheme should be expanded by the government. The amount of old age pension scheme should be increased. The 2007 law meant for proper care of the elderly in every district hospital should be followed properly. The implementation of the national program for health care of the elderly should be expedited. In view of demographic trends, India should rethink its health care policy with a prioritizing approach to the elderly, based on Kiran Karnik's article published in the Hindu, December 27, 2021.